Hello, TikTok. This morning I want to talk about triptans. These are a class of medications which are used very commonly for migraine headaches. These are used for stopping the headache, not necessarily preventing the headaches. And they're prescribed quite often by primary care docs, gynecologists, neurologists, across the board. Everyone prescribes these drugs, and a bunch of folks take these drugs. And for the most part, they're very effective. Here's the big but, though. The way these medications work is that they clamp down on the blood vessels. And by clamping down on the blood vessels, the headaches get better. But when you clamp down on the blood vessels, what happens to your blood flow? It decreases the blood flow to all parts of the body, including your kidneys, including your heart, including your legs and arms, and including your brain. And if you have any kind of underlying issue with your blood vessels, such as any previous heart attack, any previous heart disease, any previous stroke or TIA or kidney disease or leg vascular problems, anything at all which involves the blood vessels. Well, when you decrease the blood flow, now it can make those problems a whole lot worse. And it's very common for people to be put on these drugs in their 20s or 30s when they have no medical problems, and they just get these meds refilled year in, year out, decade in, decade out, and now they're in their 50s or 60s. And all our bodies age, and as we age, we all develop some type of underlying cardiovascular disease, yet they keep taking these triptans. And I cannot tell you how many patients I've seen that have been on triptans and now they're still taking triptans in their late 50s, 60s, and 70s, and they swear by these drugs, and they've had strokes or heart attacks. So my word of caution to you guys is these are great drugs, but please make sure that you don't have any risk factor that may trigger some of these horrible underlying events because of the mixture of triptans and your medical issues. Be safe.